Hey everybody, my name's Josh Alquist. I'm here to tell you about an awesome new benefit that you have access to through your workplace, being graciously and generously paid for by Andrew. So what I'm about to show you is something that you're getting access to because Andrew's put it in place for you. This isn't something coming from Chick-fil-A corporate. It's something that you just get by being an employee of the store, which is awesome. So Direct2Care, let me share my screen real quick. Direct2Care is a direct primary care provider. So the idea is when you get sick, or if you have a question for a doctor, or if you need a prescription, instead of having to go all the way down to a primary care doctor or going all the way to an ER or an urgent care and sitting around a bunch of sick people, instead you can do that kind of stuff through us as well. The other thing is this is not insurance. So what I'm about to show you is an awesome healthcare benefit. It isn't insurance, and that just means it's not going to interrupt or interfere with any of the insurance that you might have. So if you happen to have insurance through the store or through a spouse or through Medicaid or something like that, this is just sort of going to hover over the top of what you already have, and it's going to save you a bunch of time and money. If you don't have insurance, which is probably common, this is just going to be an awesome new primary benefit that you're now going to have access to. So what I'm going to have you do first, before I dive into the slides, is I'm actually going to have you scan this QR code. It's going to bring you to the App Store, and I'm going to want you to download it onto your phone, download the app onto your phone. And as soon as you get the app downloaded into your phone, I'm going to show you how to get logged in. So let me share a different screen really quick while you're doing that. So you should now see, whoops, let me open it. Here we go. You should now be seeing this screen that says a guide for locating account using Find Me feature. So there are basically two ways that you can get logged in. The first is the login button. So you will have received probably like a welcome text and a welcome email, and there's going to be a temporary password in there. So if you want to use that, you can just use your email as your login name and your temporary password to get logged in. What I'm going to show you really quick is how to use it, how to do it using the Find Me feature. So you're going to click Find Me, put your name in, your last name, your date of birth, and your phone number, and you should pop right up. If you don't pop up, just double check to make sure you put your phone number in right or your date of birth right, or you've spelled your name right. Sometimes we might have your old phone number on file and you're trying to put your new one in. And if that's the case, then just use the login with the temporary password. But otherwise, if you pop up, you're going to click confirm. It's then going to send you a text code. If you don't see the text code pop up, it's going to be in your spam. And you probably are an Android user. A lot of Android users don't know this, but in their text, you go into your text, there's actually like a couple of buttons you can click, and behind that you can see there's a text box or a spam box in there, like a spam folder, I guess is a better word, and it'll be in there as well. So find it in there. You're going to hit verify. It's going to have you create a new password. You're going to accept to log in, and now you're in. So that's the way I like to show, because it's just a little easier than having to go into an email. So let me go back into the deck and we'll kind of get started on how this works. So Direct2Care, like I mentioned, it's a direct primary care provider, which essentially means you have as many free doctor's visits as you'd like virtually. It's an app-based platform. It's free for you, and it's free for anybody that lives with you. So it doesn't have to be just like somebody you're married to or a biological child. It could just be whoever you live with. So if you have a pretty extended family, maybe you live with your parents or grandparents, or you've got cousins in the household, as long as they live there with you, I'm going to show you how to add them a little bit later. They would have access as well. If you live with your girlfriend or boyfriend, they would have access. If there's kids in the home, they would have access as well. It's an app-based platform, which I'm going to show you how to use in a minute. Anytime you want to talk to a doctor, you click a couple of buttons, and about 10 to 15 minutes later, a doctor will show up. It's free for you, and it's free for everybody that lives with you, meaning nothing comes out of your paycheck, and there's no copay. These are all things being generously paid for by Andrew. We do primary and workplace care, ER and urgent care avoidance, and we have a big emphasis on mental health. We're licensed in all 50 states. But if you ever leave the state of Minnesota, we can still treat you wherever you are at the time. Everything is HIPAA compliant and private. So even though Andrew is paying for it, you still have the ability to use this, and he's not going to know. He doesn't want to know anyway what you're using it for, but just legally speaking, you're protected just like you would be if you went to any normal doctor. The app is in English and it's also in Spanish. So you probably noticed that when you first logged in, it's going to ask you to toggle in between. And we're licensed in 200 different languages, so we can help you a lot. We don't collect social security number, and the way that you add your household members is just in the app, and I'll show you how to do that. It's built on an honor system. So if you're worried about anybody that lives with you that might not have a social security number, they're still able to use this. We're not going to need that data. Okay, everything you see here are all things that we can do. As long as it's not an emergency, we can probably do it. So things like colds, flus, sinus infections, ear infections, but also things like pink eye, bladder infections, rashes, cuts, scrapes, all those kinds of things that you're typically going down to like the urgent care for or an ER, we can do those. As an example, if I was your employee and I called in, let's pretend I had strep or I thought I had strep, the doctor could ask me a bunch of questions to try to diagnose me with strep. So I don't have to go anywhere to get a strep swab. They can do that just by asking a lot of my symptoms. What they would then do, if appropriate, is they would diagnose me with strep. They would write me a prescription for an antibiotic. And all I'd have to do is go down to Walgreens or CVS or wherever it would be. And that would be the only thing you would pay for. So the visit would be free. And all I'd have to do is pay for the prescription. Typically, if I needed something like a basic antibiotic, we're going to use things like Cost Plus or GoodRx, which are companies that help you get discounted rates. And so typically, for a basic antibiotic, it's probably going to cost you between like $5 and $12. It's going to be very affordable. We can also refill prescriptions. So if you just need your blood pressure medication refilled or your cholesterol medication refilled, like we can do all that kind of stuff without you having to go anywhere. We can do that with you. The only thing we don't do is we don't do controlled substances. So that's something like Adderall or like Oxy that falls into a different category where you legally have to go physically be seen somewhere. If you're on stuff like that, you're typically already seen a doctor. But if you need to be on something like that and you don't have a doctor, call us and we can help you, point you in the right direction to find a doctor that can give you that kind of stuff. We can also do primary like annual visits. So if you just haven't seen a doctor in a long time, maybe you can't afford one or you don't have time or you don't have insurance, you can call us. We can do an annual checkup with you. Part of that process is we'll get your blood work done. We'll find a cheap place in town, like a LabCorp or something like that. And we'll negotiate a rate down on your behalf. Typically, we can get you a blood draw for probably between like $20 and $50. So it's going to be pretty affordable. And all you're going to have to do is show up. You're going to pay them for the blood work. We'll set the appointment up for you so you don't have to do any of that. And then you're going to jump back on a call with us and we'll go over the blood results with you as well. So we can use that to treat chronic illnesses if we find them. So for example, if we found you have high cholesterol, we could talk to you and potentially help you with that. We can also send you out for x-rays, MRIs, ultrasounds, CT scans. The most common example I give is you or like a kid in your home will get injured. Maybe they fall out of a tree and their ankle swells up. Under normal circumstances, you'd run down to an ER, you'd get an x-ray. The problem is it's like the most expensive place in the world to go. If your bone's actually like cracked, broken, we understand why people go there. But otherwise, if you're just trying to figure out like, do I get an x-ray? Do I not get an x-ray? Perfect opportunity to call us. Our providers can kind of give you a good estimation of whether they think it's actually like broken or if it's just injured, right? Is it just like sprained, strained, that kind of thing. But if we wanted to, we could get you an x-ray. We can a lot of times find people a basic x-ray for under $100. Or if not $100, it's going to be still many times less than if you just walk into an ER as well. So it's a great way for us to be able to take care of it. If we did get you an x-ray, we'll go over the results with you as well. Anything we can't do, we can refer you out for. So we can refer you to dentists, physical therapists, that kind of stuff. And then here's a list of things that we do as well. Mental health is a little different. So the medical, all of you are covered and we can treat you unlimited visits. So even if you're under the age of 18, we can still treat you for medical. The one thing is if you are under 18, if you call us, we're going to ask to get a parent or guardian on the line just to make sure it's okay to treat you. For the mental health, any of you that are 18 or older and any household members that are 18 or older, you get 10 mental health visits a year. Those mental health visits are an hour long and we'll schedule them. So we have licensed counselors, therapists, psychiatrists. We can treat a lot of stuff you see here. So when you first call in, we're usually going to talk to you for a little bit and then we're going to book an appointment with you to actually have you seen as well. I get 10 or you would get 10 and your household members get 10. So if I was the employee, I would get 10 and your household members would get their own 10 that are over the age of 18. There's a short video in probably your onboarding. It's about 1.5 minutes that shows you what I'm about to show you on slides. So if you want to watch that, go ahead. Otherwise, I'm going to show you how to get into the app. So once you're in the app, the blue button is where you're going to hit to get care. The settings is what you're going to click to add household members, or you might have a blue button right here that says add members. But if I go into settings, there's a household members tab. You're going to add them here. And here's how it works. If somebody is under the age of 13, you're just going to add them as basically as a child. Anybody over the age of 13, you have the ability to also add them to give them their own access to the app. And that just means you're going to need their phone number and their email. The benefit of that is, let's just say you've got like a 16-year-old teenager that lives with you. You could give them access to the app so you don't have to leave work if they ever need to get care. And then, of course, if you live like with a spouse or somebody over the age of 18, it's just nice for them to be able to have their own access to it too. They're not going to be able to use the Find Me option because they are not employees. They're not in the system already. So just let them know when you add them, they're going to get a welcome email with a temporary password. Just let them know so that they don't think it's spam. So we need to get care. You're going to hit the blue button that says get care. Tell us where you are at the time, who's the visit for, medical care, mental health, workplace injury. So which 3 options? I'm going to pause on workplace injury for a minute. I'm going to defer to your leaders of how they want you to use this. Instead of, if you ever got injured at work, knock on wood, but if you ever had like a burn or a cut or something like that, instead of your manager sending you to an urgent care, they might have you come to us first. If you ever just hit this button on your own, the first question we're going to ask you is, does your manager know that you're talking with us? And do you have permission to talk to us? And also, we're going to write up like a whole report. So just as an FYI, this is not private. It's not designed to be private. Legally, the business, Andrew as the operator, needs to be in the know when somebody gets injured at work. So it's kind of a whole process that we'll go through. So just defer to your leaders of when they want you to use this. But otherwise, you're going to hit medical care, mental health, services in English or Spanish. What's the visit for? If you don't see something here, you can type it in. On demand, confirm your phone number. Is the patient under the age of 18? If you're 16, the answer to this would be yes. And another box is going to pop up. It's going to ask for your parent or guardian's phone number so we can call and just make sure it's okay to treat you. So don't be surprised if that happens. It's just the law, the way it works. Then you're going to tap to consent. Now you're in the waiting room. This is going to be spinning. And you're just going to sit here and wait for 10 to 15 minutes. When the doctor's ready, this blue button will appear. You'll click it. And then now you're in a visit. You'll see the doctor just like you could see me. The doctor will be able to see you. And at that point, it's just like any normal doctor's appointment as well. What I'll leave you with is this. Direct-to-care, we can't do everything, right? We're not delivering babies. We're not curing cancer. We're not doing surgery. There's, of course, a limit of what you can do virtually. However, we're able to do a lot of stuff, probably like 80% of what people typically need in their lives for healthcare. You now have it for free. It's being generously paid for by Andrew. So when you have something, if you're ever wondering, like, can Direct2Care help? Can they not help? It doesn't hurt to call. It's fast, it's free, and at the very least, we can point you in the right direction. So looking forward to working with you. Thanks so much for your attention on this video. If you have any questions, reach out to Andrew or one of the staff, or they can always reach out to me as well. But thanks for everything. Have a good day.